What's up, fam? Another COVID update coming at you. We are really in a moment of transition now. Leaves behind me, the universe is doing it, but so are we in the city and the county in terms of our response and moving into a sort of recovery phase. So there's a lot to cover here. I'm just going to go straight from my notes on Monday, and I would invite you guys to read what follows as well. I'm going to put forward the county's actual plan, so I'm going to keep this at a high level. Because the plan is detail-oriented and it deserves a read and it deserves to be communicated with the specificity and intention in which it was created. So, with that, at council on Monday, the county came forward. That looks like county staff, John Peacock, Kara, thank you so much. Phyllis, thank you. As well as the incident command team through Karen Kahneman, who also represented healthcare system. And we got a 3.5 hour update. So there was a lot to unpack there, but the long and short is this. Looking in the rearview mirror, our response time was incredible. Literally days, and tops in the state, if not the nation. For that reason, we don't have a lot of virus around, but we do have virus around, and that virus will spread just as it did before if we do not continue to make changes. And during that time when we were self-isolating, the reason for that was to build up our healthcare system so that it could absorb more care. So that is PPE, that is testing, that is personnel. And all of those things have been sufficiently improved so that we can now test everyone who has symptoms. We anticipate being able to do that going forward. And we now have the ability to start to begin to reopen our economy, which is just as important for our health, mental health, etc., while not being at risk of overwhelming the healthcare system. Now, to do that, it's going to take steps. Why steps and not just a complete reopening? And the answer to that is because this virus is still transmutable and transmittable. It still spreads, and even with social distancing and best practices in place, it will continue to do so. As we have seen across the globe from communities ahead of us, when we reduce our physical and social distancing, there can be a reemergence or a second or third spike in cases. And so as we reopen, as we, for instance, let restaurants and hotels reopen, we want to look at 2 complete cycles of virus. It takes about a week to show symptoms and then a week to pass on and subside. And so we want 4 weeks in between each phase before we say, okay, with these new protocols, with these new efforts, we still think we're on the right path, and then we can do more. And it is important to remember in this, because I am so anxious as a person who runs a business, who has employees and families who are really struggling. It's important to remember that it is May, as nice as it is out. And normally there's not much going on here. So a little bit of perspective there. So we're moving into this phase of starting to open things. There has been a lot of confusion about what we're opening, how we're opening it, etc. I have felt that as well. So has the rest of council. And the reality is it's because it's getting more confusing. As we want to supersede the state in some ways in terms of opening, and in other ways be more restrictive for our own health and public welfare, the approach has been to work with individual industries or interest groups individually. And many things have not yet been decided, and yet they're getting spoken about in the public consciousness, they're getting picked up in the newspapers, and so there's a lot of what-ifs that are being converted to what we're going to do in the communication, which is not the case. So what we do anticipate is a second round of opening or lifting of restrictions, which should happen around the 27th. Those specifics have not yet been announced, but the roadmap for how we will evaluate and work between those and the next round, which will be 4 weeks or more, is in place. And that I'm going to be posting from here. But the goal now is to balance our health and economic needs, given that we have stood up our healthcare system to meet those challenges and worked with industries to create best practices and to proactively reimagine the future of our community's health, social, and economic resilience. And that's the challenge that we face now. So that plan, that roadmap is below. What's important is to recognize that you have a role in this, that to reduce the number of cases while reopening, we'll take actions, small actions like wearing a mask or washing your hands, being diligent in your business and your personal life, staying home if you are in any way sick, sniffling, coughing, anything. Whether we can succeed and move to the new phases of reopening will be up to you as much as it will be up to me and everyone else. So you play a role in that and take that role seriously, because we are all travelers together in this. So as we do that, a few key points that I'll just discuss briefly. The first one is testing. We've known this is a key element since the beginning. We now have enough tests to test everyone who has any sort of symptoms. We can test 30 people a day in perpetuity. The governor has announced that more testing is on the way. And we hope to expand that testing from just those with symptoms to those without symptoms as well, because we now understand that these PCR tests can capture the presence of the virus pre or in asymptomatic people. So that's being rolled out. Second part is tracing. So if this virus spreads very, very quickly, and we can have a scenario in which our economic and health needs are met, then we need mechanisms to facilitate that. So, for example, if a digital contact tracing tool can help us support our human contact tracing, which is required and cannot be supplanted, then the rate at which we can identify people and track their points of contact means we can take people out of that population, the general population, quicker to deliver care. And in doing so, we can dramatically reduce the spread of the virus, which means that we can allow for more gathering as a result. And to many businesses, that is the difference between successful summer and going out of business. If a restaurant operates at 8 to 20% margins, well, the difference between a 90% and 50% capacity that's allowed inside is all the difference, right? And so we're looking into the best ways to implement those tracing programs and getting ahead of that curve now so that we can be ready come July for what we hope to be a relatively successful summer. Of course, the known unknown is even if we do everything in our power and create the environment for a safe opening, we don't know whether people will want to be here or come, and we don't know if those who will come will resume their normal activities of shopping, dining, etc., or if they will not, and we can't control that. So we have to be real about that reality. The next thing we're really thinking about is the airport and transmission from people traveling here. There is a process underway to identify a screening mechanism for every person who enters through the airport, and the ability to then isolate those who have symptoms and put them into a safe treatment scenario. And for those who do not, provide them the tools, the resources to interact in a safe way with our community. So that is being worked on, and it is intended for every person. We also recognize that many people will arrive by vehicle, not by airplane. That's a much more difficult and diffuse scenario. And currently the county is working with individual businesses, lodges, etc., to create the best mechanisms to inform, educate, and include individuals in our plan. So that is all going on, and our IMT, or incident management team, is being transitioned now, since we are not just in the response but in the relief recovery phase, to the EOC, or emergency operations team. So that's at a high level what is going on. I think we ask for your patience, as this is difficult. We are balancing trade-offs that we would not normally accept. We will certainly be living with imperfect solutions, and there will be bumps in the road on the way to finding a solution. Ultimately, we're looking for an Aspen model that serves us by learning from the rest who are out there ahead of us in the curve and adapting them. So we're asking for your participation in that process. We're asking for your patience, and we're asking for your commitment involving and bringing it to bear. Whether we are successful in balancing health and our economy, whether we emerge stronger than we went in, will really be the result of our collective work. You, your family, your friends, council people, staff, tourists, we are in this together. There's a path forward. So coming out of this nebulous universe that I and the rest of us have been living in, I feel much better after this update, that we are on the right path, that we are wading through this river to somewhere fruitful, with the recognition that we're not there yet, and it's going to be a little bit turbulent for a while. But we can get through this together, and do check out the slideshow that I'm going to be posting following this. If you're on IG, I'll put it on the story, and if you're on Facebook, I will just put it below as images if it lets me. If not, it'll follow. So thank you for hanging in there with us, for playing your role, and can all just be really grateful to be here in beautiful Aspen, Colorado. Have a nice day.